Hello, I'm Dr. Jason Ryan, and welcome to Module 5 of the Heart Talk video series discussing palliative care and end of life. Palliative care is symptom therapy without affecting the underlying disease process, and palliative care does not require the patient to be in the final months of life. It can be given concurrently with curative therapy. Very different from palliative care is hospice, which is treatment only for the final 6 months of life. This does include palliation, but it also includes end-of-life care for patients and family and increased services and support. If you're going to start the conversation with your patients about palliative care, hospice, or end-of-life, it's very important to always check with the doctor first. One of the most frustrating things for patients and families is if their providers give different opinions on prognosis and treatment regimens going forward. Also, don't assume that your patients who may be at the end of life know that they're near the end of life. Many patients at or near end of life are never told their condition may lead to death in the near future. And in fact, just being in a hospital surrounded by medical professionals and medical technology can often lead patients to presume that there is some curative therapy out there for them. One thing that can be helpful when you begin the discussion is to encourage your patients to think about what's most important. Are they interested in staying out of the hospital? Are they hoping to return to a previous level of function? Do they want time with their family? Thinking about what's most important can help you identify goals of care for your patients. There are some practical considerations when you're talking about end-of-life, palliative care, or hospice. Who will make decisions if a patient can't speak for themselves? What are their feelings about life support, mechanical ventilation, breathing tubes, and things like this? If you can identify these things ahead of time, it can be very helpful if patients find themselves in a situation where they're critically ill. And finally, these conversations need to be ongoing. The topic of palliative care and hospice care is very broad and beyond the scope of this video series, but there are many, many resources out there. But suffice it to say that these conversations take a long time and very little is accomplished in one discussion. It's often a process as patients and families begin to understand how well they are doing and where they are headed with their care. And lastly, this is a situation where a social work evaluation can be helpful, and your individual institution may have resources that can help patients and families. Thank you very much.